Which jobs have the highest bladder cancer risk? Some jobs come with hidden health risks, especially when it comes to bladder cancer. Certain occupations expose workers to chemicals and substances that can increase the chance of developing this disease. If you work in these fields, understanding the risks can help you take steps to protect your health. Workers in the chemical industry, especially those involved in manufacturing dyes, rubber, and chemicals, face higher risks. These industries often use aromatic amines, which are linked to bladder cancer. Metal workers, including welders and those working with heavy metals, are also at increased risk because of exposure to substances like polycyclic aromatic hydrocarbons and heavy metals that can affect the bladder over time. People in the textile industry, such as those involved in weaving and spinning, may be exposed to dyes and chemicals used in fabric production, which can raise their risk. Drivers and transport workers are also more vulnerable because of exposure to diesel exhaust and combustion byproducts, which contain carcinogenic compounds. Construction workers often come into contact with various chemicals and heavy metals used in building materials, adding to their risk profile. Hairdressers and printers are at risk due to exposure to aromatic amines found in hair dyes and printing inks. Leather workers, who handle leather and related chemicals, have also been linked to increased bladder cancer risk. Farmers and livestock workers may face higher risks because of pesticides and chemical exposures used in agriculture. Interestingly, some studies suggest that occupations like nurses and waiters might have elevated risks too, possibly due to exposure to certain chemicals or fumes in their environments. The main reason these jobs increase bladder cancer risk is because of exposure to carcinogens like aromatic amines, polycyclic aromatic hydrocarbons, heavy metals, and combustion products. While smoking remains the leading cause of bladder cancer overall, occupational exposures are the second most common factor. Despite regulations aimed at reducing hazardous exposures, risks still exist and may even be rising in some fields, possibly due to better detection or changing workforce conditions. Knowing about these risks highlights the importance of workplace safety measures. Using protective equipment, following safety protocols, and having regular medical checkups can help catch any issues early. If you work in one of these high-risk jobs, talking to your healthcare provider about your exposure history is a good idea. Protecting your bladder health involves awareness, prevention, and early detection, especially if your job involves contact with known carcinogens.